Clark family used to rely on Allied Healthcare to help look after grandmother Margaret, who has dementia. They had concerns about the company even before the Care Quality Commission's warning about its finances.
It's just so unfair. They're not thinking of the workload on the staff. They're not. All it can be down to is money, cutting costs.
Allied Healthcare provides home care for more than 13,000 people around the UK. The company, which admits it's operating at a loss, employs 8,700 people. The Care Quality Commission has warned 84 councils in England which use its services to make contingency plans in case it folds. Labour say the government needs to provide extra funding.
Government funding goes to councils. Councils then have the duty of finding the care. If this company collapses, it'll fall back onto cash-strapped councils to try to find other care, which really doesn't exist.
The Department of Health and Social Care say they're working closely with the relevant authorities to ensure there's no disruption to anyone's care. But the problem for the government is that this situation is indicative of a wider problem that the sector's been shouting about for a very long time, that adult social care is seriously underfunded, with experts saying that companies just can't afford to provide care at the levels councils are able to pay.
About a third of local authorities say that they've had home care companies ceasing to trade in the last 6 months. Typically there'll be much smaller companies. And what's been happening is that local authorities have been trying to keep down the price that they pay for care at a time when the cost of the providers, particularly wage costs, have been going up.
At Allied, we know how important.
Allied Healthcare insists that the Care Quality Commission has acted prematurely and that its operations are sustainable and safe. Even if councils do have to step in, they're insisting making sure those needing care aren't affected is the top priority. Romilly Weeks, ITV News.